Greetings, everyone. I'm Saad Omer. I'm the director of Yale Institute for Global Health. I'm really delighted to welcome you to the Yale Institute for Global Health Conversation Series. In addition to Yale Institute for Global Health, which is also called YIGH, we are indebted to the George Herbert Walker Jr. Lecture Series in International Studies at the Macmillan Center for International and Area Studies at Yale for co-sponsoring this event and the series. Today's conversation will be focused on the impact of COVID-19 pandemic on higher education. We'll cover different aspects of it, but we will specifically discuss the pandemic response strategies taken by university presidents around the world. We will also consider how the pandemic has shaped the future of higher education. And so obviously, it was a little bit of a baptism of fire for several institutions. It was challenges that institutions faced. But out of these challenges come opportunities and changes for the long term. And so this is an opportunity to touch base with three prominent university leaders to discuss some of those things that will be different going forward. It is my pleasure to have, therefore, three distinguished guests to join us today, all of whom are esteemed leaders in higher education around the globe. Peter Salovey, who's the president of Yale University here in Connecticut. Betsy Bradley, president of Vassar College in New York, and President Firoz Rasul, president of the Aga Khan University, which is headquartered in Karachi, Pakistan, but has campuses in many parts of the world. Before moving to our question and discussion, I will introduce each of our guests in a little bit more detail. Peter Salovey is the 23rd president of Yale University and a professor of psychology. He has held several leadership positions at Yale. Since becoming president in 2013, he has led the development of new programs and facilities, strengthened partnerships worldwide, increased access to Yale College education, which is a remarkable goal and achievement for a university, and enhanced multidisciplinary collaborations and entrepreneurial opportunity for faculty and students. During the COVID-19 pandemic, President Salovey has been leading Yale's efforts to control the spread of the virus and mitigates its impact. Yale scientists and scholars are conducting research on treatments, tests, and vaccines for this virus, and helping people understand the science behind the public health guidance, and collecting and analyzing data to address issues like unemployment and vaccine reluctance. So it's been a 360-degree response from a university that has multiple areas of excellence. Betsy Bradley has served as the president of Vassar College since 2017. In that time, she has led the college to establish new programs and partnerships in India, Rwanda, and China to bring the model of liberal arts higher education to these settings and in many parts of the world. And most recently, she served on New York State's reopening advisory committee and helped draft the guidelines for New York higher education reopening in the midst of the pandemic. And so it was a pretty daunting task for university leaders to figure out how to accomplish their educational and research missions. And I think New York was lucky to have someone with Betsy's background as a university leader, as an educational leader in the state. Prior to becoming the president of Vassar, President Bradley was on the faculty at Yale for more than 20 years. She was elected to the National Academy of Medicine in 2017 and is a member of the Council of Foreign Affairs. The third esteemed guest is President Firoz Rasul. He has served as the president of the Aga Khan University since 2006. Under his leadership, the university has grown geographically, but also programmatically in terms of its impact and diversity. AKU, which the Aga Khan University is known popularly as, now operates in Kenya, Tanzania, Uganda, Pakistan, Afghanistan, and the UK through its 6 campuses, 7 teaching hospitals, 300 outreach medical centers, treating more than 2 million people each year. AKU's teaching, research, and healthcare have been transformative. And under his leadership during the COVID-19 pandemic, AKU earned its position as a trusted partner to national governments for innovation in health and education policies, emergency response, and clinical trials for vaccines and therapeutics. For example, AKU's hospitals were first in Pakistan and Kenya to treat a COVID patient, to offer molecular testing, and to administer vaccines on behalf of governments where AKU is based. So it's my pleasure to welcome all three of our guests. I'll start the first round with a big picture question. Peter, what was the biggest challenge you faced as a university president, and how did you respond?
Well, thank you, Saad, and it's a pleasure to be here and a pleasure to be with so many people today, with fellow presidents Firoz and Betsy. Really an honor for me. And I think it's very important to emphasize before I answer the question that while I may be the president of Yale, the team working on our COVID response was enormous and committed. And Saad, for example, was on a call every morning at 7 a.m. as part of our public health policy group, really helping us understand the data and make campus policy on the basis of science and data. And many pitched in. Our biggest challenge, in many ways, I think, is the challenge of every college and university president, and that is to do two things: a massive pivot that required a multifaceted changes across the whole university, while not giving up on the idea that we are going to continue our mission, education and research, primarily. So as we started to hear about the novel coronavirus last winter, but before it came to this country or to our region, we were already planning on how do we keep the Yale community and our neighbors safe. And I have to say, that is the single biggest challenge, right? How do we make sure that our university doesn't become a vector for the disease in a way? How do we make sure our local community is safe, but that we're not spreading this disease through our host city and our region and beyond, right? It's an enormous responsibility. And then how do we continue education and research while doing so? So I would say the biggest challenge, and I'm speaking at a pretty abstract level here, is balancing these two objectives: staying safe, keeping the community safe, keeping ourselves from spreading the virus beyond the walls of the campus, while fulfilling our responsibilities as a major research university. And as a research university, we knew that we would need to rely on our experts in public health, our experts in medicine and nursing. We knew that we'd get insights from people in student affairs and housing and dining, just give a couple of examples. We knew that we needed to quickly put together a public health policy group that I mentioned earlier, an emergency policy group to implement recommendations from the health policy group. And people all over the campus really responded. So within a couple of months, well, within a week and a half of sending everyone home, essentially, for spring break, we were able to pivot to substantially an online learning environment. This was thanks to our faculty who were willing to learn new skills very quickly, and thanks to a great teaching and learning center called the Purvu Center, who provided coaching and technical assistance and instruction. And very quickly, we were able to reopen laboratories, especially the ones doing research relevant to COVID, its transmission, its treatment, its prevention. But I would say perhaps the most important, and this will be my final comment, I'm speaking a little too much at length here, are the most important component to being able to stay committed to our mission, making sure that we were teaching, making sure that our researchers were advancing ways to fight COVID-19, vaccinations, treatments, innovations in patient care. The most important single thing that happened on this campus so far was that our students and others adhered to the guidelines. People wore masks, people social distanced, people stopped gathering in groups. And that happened immediately, and it has been sustained for 14 months. The strongest warnings that we heard was that particularly students would not do that. And you could not trust your students to do that. And there were editorials being written that it was unfair for university presidents to put that burden on students, undergraduates in particular, or late adolescent, young adults. They couldn't be trusted to do this. And we made the decision that we were going to trust our students to do this, to do the right things. We were going to make it as easy as we could for them to do the right things. And we were going to be as clear as we could, communicating what needed to be done. But at the end of the day, we were going to trust our students. I don't want to be president of a university where I can't trust our students to do the right thing. And I'm glad we did. It may have been the single most important component of all this to answer the question, the part of this that was the single most specific challenge. And I'm just grateful and proud that our students and our community as a whole did the right thing and continues to do the right things in response to the threat of the virus.
Excellent. Before I go to the next speaker, I would remind that people have the ability to sort of ask questions that we will channel towards our speakers, our panelists, in a while, after we sort of get through the first part of the section. A lot of you are watching it on Facebook Live. And so there's a way to send questions through that as well. And so appreciate everyone staying engaged. Betsy, you're leading an institution that had a few unique assets: its location, its student body, and a president who had a public health background. Any specific insights, again, in terms of the big picture, the biggest challenges you've faced, and anything you'd like to share that university leaders can learn from your experience and your unique vantage point?
Thank you, Saad. I really appreciate being invited. And Peter, it was so nice to imagine and think back to what Yale was like. So congratulations to everything you've been able to accomplish in these last treacherous 14 months. Just maybe a little bit of orientation. We have about 2,500 undergraduates at Vassar, faculty of 300 people, about 1,200 employees. And we stayed open through the whole pandemic and still are. So we have about 85% of our students are on campus, taking classes in person. Many faculty want to do some kind of hybrid, or there are students remote. And we have a ton of tents around. So ultimately, depending on the weather, the classes are 50-50 in person or not. Remote. In the fall, it was more like 70% in person when it was nice and sunny, and I'm hoping to see that again this May. So it's been quite a ride, and I think looking forward and looking back, the question you had posed to us, what is the biggest challenge? I actually think there are a couple that happened really early on. The first biggest challenge was to screw up the courage to say, we're coming back. And I remember the exact senior team meeting when I could see a path towards how we could actually house students on campus. And I was working with the New York State, so I knew it would be, by the guidelines. But I remember saying to people, look, we have to decide now we're coming back or we're not. You can't decide that in a month and a half. It has to be now, and we're going to have to plan every single minute for the next 8 weeks to be able to do this. And, you know, our team said, okay, let's do it. So that was really a moment. And then I would say the second thing that occurred is very soon after that is we set our values. We had a long meeting about what were our values, and our values ultimately were to protect the most vulnerable among us. So no matter what we did, we were going to either the financially vulnerable or the medically vulnerable or maybe isolation vulnerable, socially vulnerable. That was job one. And our second value was equity. Everything we did, we tried to do equitably. So if we were going to allow the athletes to do this, we had to allow the rest of the non-athletes to do that. In other words, the context would be one where we could be as equitable as possible and in all of campus response. And then like Peter, we said, our third value is our mission. We provide the highest quality liberal arts education in an inclusive and diverse setting, and we're going to keep that mission alive. So setting those values ended up being fundamental to everything we did. And then I would say the largest challenge, which was similar to what Peter said, was culture change. You know, how do you get 2,500 students to decide, yeah, they're going to be not socializing with each other the way they used to, not going to eat indoors with each other for a while, all of the various pieces. And how do you calm down the parents who are very nervous about the fact you're going to do this? And that culture change really came through a mechanism we called Vassar Together, which was about a 40-person committee of faculty, students, staff, administrators, coming up with what would the guidelines be. And we tried to use harm reduction. What were guidelines we could live by? What were things we would say, you know, we can actually hold everybody on this campus. And if we do that, then maybe they don't need to be so careful masking because they're not getting exposed outside once we know they're negative. And honestly, that worked. It was, and still works. I mean, even now that we're more vaccinated than we were, we're constantly looking back at these to say, okay, well, can people go into town now? Or can we have class inside at the normal density? All of those now go through the Vassar Together group. And if there is any sort of abrogation of the expectations, we also have a large group called CCT that actually re-educates, does restorative justice, does do some referral to student conduct if there are issues. So those structural pieces that we put in, I think they were challenging. I guess the culture change was the challenge, and I think those structural pieces really helped us achieve it, at least so far. But look, I'm still learning from everyone else. So don't tell me to teach others. I want to hear what Firoz and Peter have to say and learn from that so we can continue to be healthy and safe.
Great, wonderful. So Firoz, AKU has this unique role in multiple countries as the premier sort of healthcare teaching institution, and also as increasingly in other fields as well, and especially in education and media, et cetera. Any thoughts from that perspective, the biggest challenges that you faced as a university president, and how did you respond?
Thank you very much, Saad, for this invitation. And it's fascinating listening to Peter and Betsy to hear their experiences in the last 14 months. As you pointed out, we are in multiple countries. And the first thing that we had to figure out for each of our countries, what the government was doing. And remember, our governments are all in the developing world. And they initially were not sure about whether they should lock down, whether they should allow continued engagement or interaction of people. And they were sending out signals on what schools and universities should do, public transportation, and so on, lockdowns on shopping and other areas. And the lockdowns were much more onerous than anything I think we've seen in the US or in Europe. And so we were trying to navigate our way through that to say, how do we keep the institution going while we try and work with the rules and regulations from the local governments? And even those rules were changing almost by the week as they were learning more, as all of us were learning more. So that was our first challenge in trying to figure out what we could and could not do in each of the countries. Borders were closed, so we have movement between countries was curtailed, and that also affected our faculty who used to travel between campuses or within the country. So that was the first thing we had to adjust to. The second thing that I would say that being as an international university is, how do you now come up with a set of common goals or values, as we've heard, that we are going to adhere to and practice while complying with national, in multiple countries, requirements. And so that was a big challenge for us, and we had to figure out how to do that. And one way, I guess it was more by the invitation of the government than by any deliberate strategy by us, was we were appointed on all of the advisory groups that each government had set up to help them make policy decisions through this process. So we had our faculty, our researchers, our administrators on several committees with governments. And so we were able to influence, shape, or inform. Look, if you do this, then this is the consequence. If you do that, then maybe we can adjust this and be more flexible in some areas. So that was the second challenge. And I think the third, for us as a university, because we are a private, not-for-profit university in the developing world, most of our income that we support other than tuition comes from either donations or comes from the income of our hospital. The 7 hospitals that you mentioned around the countries that where we are. And immediately what happened was, as COVID came about, the non-COVID patients disappeared. They just evaporated. And that was our income. And we had to figure out, how are we going to keep going without the flow of funds coming in from our hospitals and healthcare system? And that was a big shock to the whole system. And I think Peter used the word massive pivot. I think massive is an understatement. I mean, the pivot that we had to figure out is, how do we not only keep going with the education side, but also how do we continue to run the hospitals? Because people wanted care. They wanted to come for tests. They wanted to know whether, this fever they have or this cold they have is not something more serious. And I remember one day in Karachi, our hospital was full. The emergency was full. And we had a group of 2,000 people outside trying to get into the hospital. And we had to get the police to stop the people from rushing the campus. And the campus at the hospital is also where our academic facilities are. So the students couldn't go in and out. People couldn't go in and out. And this panic set in about, what's going to happen to me. And of course, it affected our staff, and it affected many of our faculty and doctors and nurses who were all trying to provide. So we were, on the one hand, trying to teach and keep that going. On the other hand, trying to make sure that we kept our facilities open for those people who needed care. And thirdly, was trying to figure out, well, how do we actually get some funds out of this? And that was our biggest challenge. And it continues to be. Although some of that is stabilized, we figured out how to separate between our facilities, our campuses, our hospitals, those patients that come for COVID or COVID testing or COVID treatment, and those patients that come for non-COVID healthcare, and how we can continue to give them the confidence that we will keep you safe, you will get treated for heart disease or diabetes or cancer, whatever else you have, and that we will help you continue to get recovery from your disease and make sure you're not going to be infected with COVID. So for instance, every patient that comes in, we test them for COVID, just to make sure that they're not carrying something asymptomatic, and then we're dealing with a different problem. And so we figured out a protocol, a system, where we're able to do this. And the last thing I would say, before we open it up to questions, is we set up a global response team. We call it the GRT. We meet once a week. We used to meet once every 2 weeks, probably go back to once a week. Depends on we're on the 3rd wave in our countries right now. So we will have to adjust. And the biggest challenge that we're facing, not just the fact that we have increasing number of patients, but what are we going to do about vaccinations? You mentioned that we are one of the few government vaccination sites, but you're talking about very few vaccines, because most of the vaccines that come to the countries where we are will come from COVAX, or this facility, Gavi set up facility. And COVAX gets all of its vaccines from the Serum Institute of India, we just stopped shipping. And we don't know when it's going to resume. So the lack of vaccines in the countries where we are is a massive problem. It's a huge problem. So for us, going back to some sort of normal or some stability is still not on the cards. It's not in our vision because we just cannot see when our students and others will be vaccinated. The best we've been able to do is vaccinate some of our frontline healthcare workers. But other than that, this is an ongoing challenge that we will face for the foreseeable future until we see some solution to vaccinations for other countries outside the Western world. And we see solutions that we figure out how to live with COVID in all of its different variants and manifestations over the next period of time. I'll stop here now.
That's a really good point you raised. And if I may comment on that, as someone who has spent most of his career on vaccine research, I think we, as a world, we have to do better in terms of getting the vaccines out to countries where the outbreak is not going to be over in a few months. The prospects of things getting under control for higher education, for countries like the US, are high, even with the variants, etc. But the inequity in vaccine distribution is going to continue to impact higher education and the broader society going forward. So I think as academics, as institutions, and as students, I know there's a bunch of students that usually sort of watch our events in this conversation series. It is our responsibility to be advocates and problem solvers with our partners in low and middle income countries. Switching to sort of another sort of round of questions, Peter, what changes have occurred that will strengthen the institutions like Yale moving forward, particularly how it engages with the rest of the world?
Yeah, thank you for that question. First of all, I would say that our worldview has changed as a result of COVID. We more than ever recognize that we are citizens of the world and we have obligations to the world. Once again, what COVID has done is make the question of disparity, of inequity, so salient to us. And I think we can all know that intellectually, but as the pandemic unfolded, what communities were affected most severely, what individuals had the most severe outcomes, and now as we have vaccine, where is the vaccine being distributed and where isn't it, right? So we as institutions of higher learning, we have to recognize that we can play a role in promoting inequalities, promoting disparities in health, or we can play a role where we're part of the solution. And I think going forward, we need to be thinking, and I know most people share this view in principle, but we need to be thinking about how to do that, how to reduce disparities in our own society and globally. Now, you asked me the question, what changes have occurred that would strengthen institutions moving forward, particularly how they engage in the world. I think we have become much more nimble as a result of dealing with the pandemic at working across boundaries and at collaborating, right? The value of collaboration has never been clearer, and that happens at multiple levels. So our administrative structures find people no longer in their silos, no longer not talking to each other, but working with each other every day. The number of people who have been working for 14 months with someone they didn't even know prior to the pandemic is huge, right? The number of faculty working across boundaries and disciplines, right? So the people modeling the epidemic, working with those developing vaccines, working with economists about how to deliver vaccine, right? Much more integrated approach to solving a problem. and of course, a more global perspective on how that problem needs to be solved. No one person, no institution, no nation can solve a crisis like this on its own. I think the crisis has really accelerated our understanding of the need to participate and engage in multidisciplinary teams and international partnerships. Let me give you just one example. It's a small example, but it's important. So since the start of the pandemic, the results of thousands of not yet published studies from around the world relevant to COVID-19 have been generated, right? Findings from thousands and thousands of studies, tens of thousands probably. Well, how do we make sure there's a way for everybody to benefit from those findings? Well, Yale partnered up with Cold Spring Harbor Labs and BMJ actually to create something called medRxiv. And it's a preprint server for health-related research. And, this is a small contribution, but it really allows scientists to share data and insights across boundaries of discipline, across boundaries, across national boundaries. And it can dramatically accelerate the search for treatment, clinical treatments, the search for vaccines. And I think it's a good example of how do we build networks, platforms, ways of working across the world that break down barriers that historically have stood in the way of progress. I think universities play a particular role in their ability to convene, their ability to create such platforms, their ability to work in a less politicized context than our governments can, with others, like-minded others around the world in addressing something like a pandemic, but other kinds of global crises as well.
I think that's a great point. Moving on to Betsy. So there's been I'll sort of give you an audience question. There's a lot of discussion of keeping campuses safe, at least in the U.S. in fall through vaccination. Do you think requiring students, and that's the question from one of the audience members, do you think requiring students to be vaccinated will become a norm on college campuses, at least in countries where the vaccine is available?
Thanks for the question, and I saw that in the Q&A, and nice to see you since I know the person who asked. I think it's too early to tell. That certainly is our approach at Vassar, that students will be required to be vaccinated. However, they will be able to opt out if they have medical reasons or religious reasons. There's always a path off, but we'd like to get ourselves to 95, 98% of our students are vaccinated. And I think that is really an important piece, and it ties very well to sort of this larger culture of we precedes me. We've worked on that hard at Vassar, and I do think at this time, students get that getting vaccinated is part of that. Maybe they're nervous about it, but I think at the end of the day, they're going to privilege their more social environment than their own individual view on that. We did, in fact, yesterday have a clinic here and vaccinated 450 people. So that was really exciting. Again, working with the state of New York, and I hope that we'll be able to do that over the long haul.
I just want to quickly say I completely agree with Betsy, and we need our students to be vaccinated. We're working very hard to get vaccine available to them in an easy way. And it's probably too early to answer the mandatory question, but I definitely lean in that direction quite strongly.
Great.
Good to hear that.
So I'm so glad, as a vaccine researcher and then someone who has contributed to vaccine policy, I'm particularly happy to see a bunch of vaccine-related questions. So the next question is to Firoz, especially given sort of AQU's role in policy, et cetera. How can universities all across, but deal with misconceptions regarding vaccines around the world, in countries where you work, and how can institutions of higher education, especially with a strong health component, convince people that these vaccines are safe and effective? This is another audience question, as I said. Yeah.
Right. That's the difficult question, is I think in any part of the world, but certainly for us, vaccine hesitancy or reluctance has been a fact of life for many years now. As you're aware, all the different types of vaccinations for children that have been a challenge for countries like Pakistan and East Africa. Polio vaccinations have been a big challenge. As you know, that Pakistan is one of the few countries that still has cases of polio, and the vaccinations campaigns have been mostly successful, but not entirely successful. And the reasons vary from social, political, plan, to, I'm not sure I would agree that in our countries there are religious reasons. There may be people who take advantage of or use religion as a reason for people not to get vaccinated. So the issue of vaccine, first for us, it's availability, as we mentioned. Once we have vaccine availability, then we hope that we're able to vaccinate as many people as possible. The challenge is going to be access to remote areas where our populations live. And then once you get to those remote areas, working with the clan leaders and the tribal leaders to have them agree that that village will be vaccinated or not. And vaccinations have had a history in parts of the world where we work, which will make it, I think, a challenge that we are going to have to work with governments, work with social groups, work with village communities, with civil society, to be able to get people to become much more comfortable that they will be able to accept vaccines. The issue also, as you know, Saad, as a public health expert, in the first wave and the second wave, perhaps, Africa and Asia were less affected. If you look at the rates, and people said it was the demography, much younger population, it was innate immunity because they live with pathogens all the time. I mean, there were lots of theories that were out there. So people have this sense that, well, it's not going to affect me. This is a disease of the West. That's where it's happening. Those of us who live in the developing world are not really going to be as affected as those elsewhere. But that's beginning to change. If you look at what's happening in India right now, and if you look at some of the countries of Africa as well, South Africa being one, Kenya, which is where we are based, we can see a massive surge in the third wave. And so obviously something is changing. Either the variants are changing it or some other factors are changing. So this smugness, if you like, about we don't need the vaccines is going to disappear very quickly. So it's sort of a long answer to your question, but I think it's going to take multiple inputs and multiple players and multiple factors to be able to convince people to be vaccinated.
Great. So the next question is Peter, I'll ask you the question and others can chime in, is from Dean Sten Vermund, who's the dean of, for those of you who don't know, who's the dean of Yale School of Public Health, is a very prominent public health professional, and has contributed substantially to the pandemic response during this pandemic as well. So he obviously, his initial comment is that he congratulates the university's leaders for making their respective communities safe. But his question is that there were a lot of parallel efforts that happened at each campus. Is there a way to come up with SOPs, approaches that can be shared across different universities, at least different classes of universities, different categories of universities based on their size, location, and the composition of student body, etc. So maybe, Peter, you can start, and if others want to chime in, that'd be great as well.
Sten, thank you for that question. And I think there are informal efforts to do that, but I think the general goal of trying to write the case study and develop the standard operating procedures for the future is a very, very good one. I'm part of a few of the networks that Yale is a part of. So the Ivy League presidents get together on a pretty regular basis, and there's an incredible openness about sharing our experiences with COVID. The AAU, which is a group of research universities, it's primarily US, that group gets together and talks among itself, sharing information. So I think it'd be great to step back and try to write a playbook for the next time. There's certainly, it's very interesting, right? Because there's certainly lots of general principles that we can develop. I think one of them is, listening to experts, respecting science. I'm thinking at the most general level, right? Listening to experts, respecting science, acting congruently with, for us, the guidance from the state of Connecticut, guidance from the CDC. Having said that, there also is a lot of local variability. Betsy was giving the example. They are in a fairly rural part of the state. There's an important town near them, but
careful.
Well, you have a small city. You have a small city, and then a larger rural catchment area, I guess I would say. But every campus is a little different, is all I'm saying. And even when I talk to the Ivy League presidents, what could be done? Let me not make it so personal. What could be done at Dartmouth, sitting in Hanover, New Hampshire, was very different than what could be done at Columbia, sitting on the Upper West Side of Manhattan. Just to use more poignant examples or more obvious example. So yes, I think we can write the standard operating procedures. And I think step one is going to be listen to our experts, listen to our scientists, respect the modelers, and the like. But then there is going to have to be some variability across institutions too.
Great. That's I think that's an important set of principles for perhaps other crises as well, I guess, other than pandemics and so on and so forth. Betsy, switching to international collaborations, and sort of any thoughts on how COVID pandemic has played a role in connecting universities around the world and how universities can effectively and strategically create learning networks? So that's another question from our audience.
Yeah, and I agree with what Peter had just said about local networks being so important, but let's take it to the higher level. What I've sort of witnessed during this pandemic is and again, this is very much reflective of Vassar and Vassar's sort of deep commitment to the liberal arts and multidisciplinary thinking and sort of critical thinking. What I've really noticed is universities around the world that are just dipping their toes into what really is liberal arts. And particularly, I'm thinking of the University of Global Health Equity in Rwanda, which I started working with when I was at Yale, but we continue to at Vassar, or the University of Liberia. These are places that are really working to develop a medical care system and a healthcare system that can prevent future pandemics. And what are they asking for? They're asking for some courses that prepare people in the areas of the liberal arts, meaning critical thinking, humanities, thinking about it's not just the medical approach to the vaccination and the dealing with COVID, but the thinking more broadly about humanity and how history can teach us how we might want to deal with these things in the future. So what I find interesting is whether we will ultimately have more international collaborations where we're trading what each other knows. In the case of Vassar, I think we're very well versed in the area of liberal arts and the pedagogy that goes with that. And I actually think the pandemic has shown how important those sort of out-of-the-box thinking skills are. At the same time, As Peter said, we're in one place in New York, and we learn a lot from being engaged internationally of what others may be prioritizing, et cetera. So I think it's opened up opportunities, to tell you the truth. Plus, we're all used to Zoom now, so it's so much easier to have conferences. And just this event, was a tenth of the price it normally would be to fly everybody in and whatnot. So I think we're really galvanizing that kind of collaboration internationally, and it will amplify over time.
Wonderful. Firoz, AKU played a very interesting role in quickly building capacity in healthcare providers in countries where it works. So through, for example, building capacity for critical care or sort of patients who require critical care, even when it's not available, and quickly upscaling, scaling up undergraduate education online, et cetera. So any interesting perspective of using these online platforms that can outlast the pandemic, that were built up fairly quickly, both in terms of the university's core mission, but as its expanded mission to build capacity in a crisis, especially in a situation where internet access is not uniformly available?
So 2 parts to your question. So the first one, I would just want to broaden it a little bit and maybe pick up on the international collaboration question you passed on to Betsy. In parts of the world where we are, Saad, one of the lessons for us during COVID was the following. As soon as the pandemic hit, we couldn't buy PPEs because countries stopped exporting them. There were rules that said you can't export. You couldn't buy therapeutics because countries were stopping their companies from exporting it. You can't buy vaccines. And we realized in the developing world, we were at the mercy of the generosity of others. And the WHO and other systems, Gavi, COVAX, while well-meaning, had limited ability to make a difference in what I just described. So it became very clear to us very quickly, we are going to have to build local capacity to be able in research, in therapeutics, in understanding treatments that work locally, but that autonomy, that independence from, or the reliance or the lack of reliance from other international players was something that hit home really hard. And this is something we are thinking about, and it'll shape what this university, our university, and other universities in parts of the world where we are, what they decide to do and where they decide to put their focus as we go forward. As far as the issue of, as you said, going to online learning in countries where there's a challenge of the availability of the internet, we pivoted very quickly. We were very fortunate. We started a teaching and learning center or a network very early that started to look at hybrid learning, blended learning, asynchronous learning, because of the sheer number of countries we were in and the dispersion of our student body and faculty for that matter. So we had already started to train our faculty in thinking about this, but when the pandemic hit, it was a very sudden. I think Peter used the word nimble, agile. It would be the other word. We had to be extremely agile to switch and start teaching our faculty about creating materials that they were using for face-to-face teaching for online learning. And the population of students didn't know how to learn online. They'd never done it before. So we not only had to train the faculty, we had to train the students. And the students, many of whom were remote, either had limited internet access or intermittent. And the one thing that in the West we take for granted that we don't have in our parts of the world is power. We didn't have electricity. So why we said to the students, you need to go home and you'll learn from home. And there was intermittent electricity. So all of these challenges continue for us. And within that, we are trying to make this work. Now, we were able to give devices because of donations and generosity of people to our students, so they could actually have a device like a notepad or a computer through which they could access. And that was as basic as that we had to deal with. But I'm happy to say that when we look at the results of our students after 14 months, although they didn't, the academic year was longer because we had to stop, we are encouraged by the results that we see, although Peter's point is very important. it's not the same. We are seeing that the experience is not the same of people who are learning online versus among classmates, among others, among faculty. And so that is something we're trying to figure out, how we can create that environment so people feel that the experiential learning is an equally important part of content that we see that comes through online learning.
We have another question from the audience, and it's about teaching and learning centers. And Peter, Purvu Center at Yale played a hugely important role in sustaining our activities, our quality of education, etc. But going forward and thinking, building on our experience, and this question comes from Professor Tashmin Khamis, who is a leader in curriculum development and quality in teaching, etc., outside Yale. And so what lessons can we share in terms of the value of teaching and learning centers, not just in pandemics, etc., but beyond that as well?
Sure. We have a wonderful teaching and learning center at Yale called the Purvu Center. And in a matter of 2-week spring break last March, they offered classes, small group workshops, and one-on-one tutorials to essentially all the faculty teaching, especially Yale College students, and getting them comfortable with Zoom and teaching on technology. We weren't optimizing at that point. We were just trying to help people make the transition quickly. But what has happened over time, as both people have become more comfortable, is a lot of creativity around teaching online. And again, these teaching and learning centers can be a source of best practice around collecting these innovations. So I have a brother who teaches theater. He teaches acting online. And he said, well, I teach acting for the stage, but actually Zoom lets me talk a little bit about what happens when you're in front of a camera, and television acting, film acting, right? So he adopted, he changed. My wife teaches maternal and child health, actually at State University here in our region. And there, she had the challenges of students who didn't all have broadband, students who all didn't have easy and comfortable and isolating learning environments, and learned to change her classroom teaching in a way that kept them involved, created more active learning so that the passivity of not having your classmates around you or the lack of social facilitation didn't weigh too heavily. So our teaching and learning centers can be wonderful repositories of collecting knowledge about what works and what doesn't, and then be a great resource for our faculty. Just one more point. While teaching online, teaching through Zoom, teaching remotely, in my view, will never replace classroom instruction. While places like Yale and places like Vassar will continue to be oriented around in-person instruction primarily, boy, do they create leverage for all of us. Boy, do they create the potential for greater reach. I'm a psychologist, and there's an expression that psychologists like to use, came from a president of the American Psychological Association, which is, how do we give psychology away? Well, I think a lot about how do we give without compromising our mission, without compromising our financial health. How do we give more of Yale away? And we can give more of Yale away through, the magic of Zoom, and we do and will, just in the kinds of situations that Firoz mentioned. Just one other quick thought: how are we all going to do our work differently now that we as administrators have become more comfortable on Zoom? Is my carbon footprint going to be as large with all the traveling that university presidents do traditionally? Is it going to be as large as it once was, when I can get together with Firoz and Betsy for a meeting, on Zoom without driving to Poughkeepsie or flying to Pakistan or Kenya or where have you, right? I think we're gonna do business in a lot of different ways. And our teaching and learning centers are gonna be one of the places that picks up on helping us figure that out. Not part of their traditional mission, but they're gonna help us figure out when it works, when it doesn't.
So a couple of sort of last brief questions from the audience, starting with Betsy. I think there was a very interesting and thought-provoking question about physical challenges in accessing healthcare and what institutions have learned in this crisis situation, about helping people with that have trouble accessing their surrounding communities, et cetera, in the healthcare setting. Betsy, you have thought about and worked on these kinds of issues for a while.
Yeah, I think it's incredibly interesting and important and unexpected that for us, the pandemic made all of us unable to access what we used to be able to access so easily. And in a way, I think it really leveled some playing fields around the campus. There wasn't walking. A lot of classes could be online. People could access that better. Closed caption on everything. We worked on see-through masks so people who couldn't hear could see the lips still. And it has been sort of an amazing experience because I think now everybody understands better what disability could be and what it could in fact result in your life. As a result, we just started a very high level committee on accessibility and are starting to put together a much different approach of how do we make our environment accessible for everybody. And I never would have thought the pandemic did this, but again, it brought a sort of we precedes me approach. It made us, I think, more understanding of each other and our different abilities. So I'm hopeful for the future on this.
So Firoz, I'll give you the last brief question, which is, what is the future of international collaborations for this pandemic, which is not nearly over in many parts of the world? It's not over in any part of the world, but it is likely to go on longer in many parts of the world and beyond. What is the future of collaboration?
I think the pandemic has shown us that this is not a local situation. Something that happens in one part of the world now travels very quickly to another. And that's become pretty obvious to I think, everybody involved. I think universities have a very important role to play in terms of bringing together people to start to address some of these problems, which are now common. That's what we have seen. I don't think our governments have set a good example, as I said earlier, so far. And so I think we need to work beyond what the governments do, not within or wait for leadership from the governments, because they have other priorities, they have other constituencies that they have to satisfy. But I think there is an even more opportunity now for collaborations on vaccines, on new medications, on treatments. And in some ways, the pandemic has leveled the playing field, to use the expression that Betsy just described. We have undertaken clinical trials in Pakistan and Kenya on Chinese vaccines, on other vaccines, French vaccines, and so on. And we've contributed to the data on phase 3 trials and understanding of certain populations or certain ethnic groups. And so that's certainly been part of our contribution, and no reason why we can't also work with other institutions in developing common standards, common solutions, and common areas. Joint research is beginning to flow, and the Bill and Melinda Gates Foundation has been very strong in supporting this, and we're recipients of their grants, and we're very grateful for some of the work that they support, but we're not the only ones. And working with the University of Michigan or University of Washington, who are doing work in these areas, I think we've begun to demonstrate how much more it's possible.
Yeah, and Yale.
And Yale. I should just say, while I have a minute, that our first collaboration was with the Yale, I don't know the hospital, the New Haven Hospital. When we started, they were describing to us how they were dealing with this, because we were 60 days after, in terms of our surge that happened in New Haven. And they really helped us understanding. There was one thing they couldn't help us with, because they gave us the idea you need to give bonuses to healthcare workers because of the extra mile they went, right? They were dealing with COVID situations and so on. And we had to explain to them that we asked our nurses to take a cut in salary so we could keep the institution afloat. So everywhere else we were able to learn from them, but I think they were surprised of the commitment of our people and the mission that they actually took cuts in compensation to be able to address the challenges that faced us. So yes, including Yale.
Yeah, so I'll just wrap our really nice and thoughtful session with a few words. First, to say that we have the next event with Dr. Tedros from WHO that is coming up. That's the next event in the conversation series. And then as we leave, I think they will sort of project the slide. So I would invite everyone to connect there, and it's shaping up nicely based on our discussion with his team and his staff, and it should be an interesting session. But the last thing I would say is that universities have a unique role in combating and preparing the world for mass challenges like pandemics, because pandemics often happen across generations. And so, universities survive corporations, they survive governments, and sometimes they survive republics. Just as an example, the top 8 corporations in the US have their life is, the average lifespan of the current top 8 is approximately 60 years. And Ivy League, the 8 Ivy Leagues have on average, I think, close to 275 years old. And so therefore, there's a unique responsibility on universities and their faculty and their students to learn the lessons from these kinds of catastrophic events and pass on to the next generation through our research, our teaching, and sharing how we advise governments, how we handle these situations, both as institutions ourselves, but also as incubators of some of the best expertise available for addressing these problems. So to our students, no pressure, but to our faculty, that it's a unique responsibility I hope we will live up to going forward for generations. So thank you to the panelists. Thank you for the engaged audience. We got a ton of questions. I couldn't get to all of them, actually, not even half of them, but I really appreciate everyone's participation.
Thank you, Saad.
Thank you, Saad.
Thank you. Thank you very much.
Nice to see everyone.
Bye. Bye-bye.
Bye-bye.
Bye-bye.